learning and kept studying. And then it was a naturopath that changed my life because I had developed chronic pericarditis in my late 30s. And so that's extremely painful. It's one of the most painful conditions you can have, and it kills people all the time. Not when they know you have it. When they know you have it, they can treat it. But when they don't know what it is, and for me as a woman in my late 30s, they just said, "Oh, you have anxiety." And it took me a long time to even get diagnosed. And I almost did die. I had the tunnel open at my feet and everything, but I was just like, nope, not, not even gonna look. I wasn't afraid. Like there was nothing, to worry about in that tunnel. I just wasn't done. And so or I felt I had to start looking into all the alternative options because the medical establishment, like you said, they will keep you alive, but they don't make you well.
No, it's quite limited. And I think, a big mistake that people make is really expecting more from it than what it is designed to offer. I mean, it's mass, there's so many people that use it. They don't have a lot of space in there for wellness or prevention or sitting down with you for an hour and speaking with you and then going, oh, pericarditis, because they've gone beyond speaking to you for 5 minutes and then here goes the drug and out the door you go, because they've got it, they have to keep up with that quota. And those public systems really define like even what most of them are able to do in terms of how they can help people. So it's really there, like you said, to just make sure that nothing, life-threatening is going on. They should be doing that. They
Yeah.
should be doing that part. They're pretty good at that part. But then that whole space between something life-threatening and being, your optimal, most well fulfilled, successful self is like this huge area. And people look to their medical doctors, they'll often look there first to get that piece, and it's just not there.
No, and it was pretty disappointing. And, people, when I was really looking into it and started to do the things that you need to do to get better, like joining the gym and getting weight training going, my friends were like, "What are you doing? I was 20 pounds overweight, so not in a danger zone really. And I didn't look abnormally large and I wasn't having problems moving around. But the naturopathic doctor that I had put it very simply, the muscle is a heart. You have to exercise the muscles or they get weak. And I was like, oh my God, I can't exercise. I'm such a klutz. And she said, just hire a trainer and then they'll tell you what to do and you just do what they do. And so that's what I did. And it was through that whole process that I started to realize that I am really strong. And on my good days, I'm very well. So I exercised when I don't have any chest pain. And then
Mhm.
this desire to do yoga training came up again. And I had had it before, but I'm a career musician and I already have like a very tough job, right? Where you're always selling and trying to get people to sign up. And, yoga is a lot like that as well. It's a bit of a hustle. And but I decided to do it anyway. And then I realized I didn't want to teach exercise. So I just went right into the yoga therapy program. So I have a very like basic training. I was in with the massage therapists and the personal trainers doing the anatomy and physiologies. And then we did pathologies, but from that perspective of the yoga care, which is really holistic of what you would do, and mostly learning what not to do for certain conditions so that you're not inadvertently making things worse.
For
And
sure.
and then that was just kind of naturally applying to myself as I was going through perimenopause. And I didn't realize it, but I took advantage of that window of time to build the muscle.
Mm.
So I wasn't aware of perimenopause when I joined the gym, and that wasn't mentioned by anybody, and I had no idea, but I did. I took advantage of that window, and I'm still taking advantage of that window to build muscle. So
Mhm.
can you say something about what happens for women in perimenopause and how it's a great time to build that muscle? And
Oh my gosh, for sure. Yes. Physical activity becomes really important as soon as you enter into that perimenopause time. And it's important for so many reasons. Like perimenopause is such a big snowballing of so many different things. But you can certainly, just the basics, right? Like when you get into perimenopause, eventually your estrogen goes down. I see lots of people who, it doesn't go down until late 50s. Like, even beyond that, you can still have estrogen dominance, estrogen excess. But as a whole, estrogen will decline throughout perimenopause. And when the ovaries stop producing estrogen, the body relies more on fat cells for estrogen production. And that's one of the reasons that many women, not all, but many women, all of a sudden have weight gain. And specifically around the center, we call it central adiposity, where it's that visceral fat. And that's your body like desperately trying to maintain some of its estrogen stores and actually buffer you against rapidly declining estrogen, which tends to give women a lot of symptoms. So whatever you were doing before perimenopause, sometimes depending on the person, you've got to step it up a little bit if you sort of want to maintain what you're used to from a BMI perspective. Second of all, depending on the type of exercise that you do, you'll be influencing your hormones. And so looking at where you're at hormonally, that should be one of the pieces that you do before you enter into an exercise program. And just like how you were saying about yoga and learning what not to do to make a situation worse, sometimes the type of exercise that you're doing in perimenopause can be having that effect of like actually worsening your symptoms. So you would want to look at your cortisol levels. These things can all be tested. You don't have to wonder, oh, I must have high cortisol based on my symptoms. Don't make that assumption. You can actually look at these things and then make decisions about what you should be doing treatment wise, including exercise, after you've looked at where you're at.
Yeah, and I think that we just aren't comfortable with the level of care that we're getting in general, right? So this is the story I hear all the time. Woman goes to doctor, starts to say, I'm more anxious, I'm having trouble sleeping, I'm having body pain, I'm having difficulty getting through my day, I'm really tired, I'm having headaches, maybe, a variety of different symptoms. And then they're basically said, okay, we're going to look at all of this stuff, but they're looking for disease that could be causing those symptoms, right? And then you go back and do your follow-up, and they've ruled out all of that disease. So they say, good news, there's nothing wrong with you. And then the woman goes into the car and cries hysterically because she knows there's something wrong.
Yeah.
And what are her options at that point? And that's usually when people reach out and find the group, they're kind of at that point. Or they'll be trying to access different naturopaths and just kind of like trying and dumping because they don't like whichever approach that particular naturopath is on, you know what I mean? Like so much miscommunication and misunderstanding about how treatment can look and what exactly could happen and fear around using hormone replacement therapy. It's
Mhm.
really sad. So what I see all the time is she either can't get a prescription or when she does get a prescription, she's too afraid to take it.
Yeah, yeah, no, it's true. There's so much misinformation out there. And even if you're trying to do your research, it's really difficult. If you're talking about HRT in particular, it is very, very difficult to pull out all the nuances unless you're in this field. And that's why you need somebody to go through it with you because are you talking bioidenticals or not? Because that'll have different levels of risk, right? And then that influences your decision making about whether or not you do your HRT. What form of estrogen are you talking about? Estriol, estradiol? Do we have progesterone in the mix? And so when people, back to what you said at the beginning, because you said so much in that was very juicy. So I don't want to I don't want to miss any of it. But what you said at the beginning about, they go to the doctor and they have some tests and the doctor goes, good news, nothing's wrong. It's, I tend to look at what has the medical doctor already done, because some people will presume, they'll go to their medical doctor and they'll ask for hormone testing. And some people will presume that it's been done. And then you look at what actually was done, and it's not comprehensive at all. And even if the medical doctor, at least in Ontario, even if the medical doctor says, sure, I'll test your hormones, they're using blood, they're
Mhm.
using serum. And so what hormone are we talking about? Because in perimenopause, we've got the obvious estrogens, progesterone, but you don't want to ignore thyroid, cortisol, insulin. Vitamin D is basically a hormone. Like, which one are you talking about when you ask for hormone testing, right? And so even if, let's say, that medical doctor does all of that stuff,
Mhm.
it's blood and serum. And when you're talking about the reproductive hormones of perimenopause, urine is your better bet, because you're getting tissue level averages in the urine. Blood is very pulsatile, up and down. So I almost always do comprehensive hormone testing properly before I prescribe, because that's where some of that nervousness and hesitation comes from as well. It's when your doctor prescribes you hormonal therapies and you haven't had proper hormonal testing, how do you know that you're getting what your body is lacking? And that is actually where part of the risk comes from. When you're talking about HRT, it's overdosed estrogen.
Mhm.
So, when you're talking about what are the standard medical care treatments that you're going to get, typically it's some combination, depending on whether or not you're still cycling, is usually one of the determining factors. But it's an antidepressant,
Mhm.
it's an IUD,
Mhm.
it's birth control pills. It might even be hysterectomy, depending on what your symptoms are. And it could be HRT. So those are all like very vast, and some of them are quite extreme. And we can do so much better, especially if you test first. Then you know exactly what to give a woman. You even know what dosages to start at a lot of the time. So there's this whole thing about, like, they go there and they try to get this evaluation, and it's like, but what? Like, what did this consist of? And most women don't know.
Well, and it's so frustrating because what I say all the time when a woman contacts me and says, "Oh my God, doctor says I'm fine. I think I'm dying." You're doing the right things, right? This is what we've been
Yeah,
taught to do.
I know.
Been taught
Yes.
to go to the doctor, you explain your symptoms, you maybe made notes, you might even have a little chart,
Yeah.
you're very specific.
Yeah.
Um, and then you walk out of there going, they didn't help me at all. Now what? And that's where there's a really big gap. So what would you say to a woman in that position? How would she find a naturopathic doctor if she's been kind of, well, I mean, they feel dismissed, really. And I personally feel like every medical doctor is also one of those people who is loving and caring and smart
Totally.
and wants
Totally.
to help people. So this whole gaslighting thing, I think is unfair because
No,
they don't know.
this is
They
what I was saying too. It's about the system, right? Like, even in Ontario, the type of hormone testing that I'm talking about, it's not covered by
are
OPID.
offered. No, it's
So
not.
they don't, really, their scope is what is covered by public health care. And so the analogy that I give to people is like, well, do you want to take public transit everywhere? Probably not. Do you want to live in public housing? Probably not. Like, these are just to keep, the lowest income people alive and moving and functioning. The healthcare system is the same thing. So you have to sort of go above and beyond if you really want that quality of wellness that you're looking for. Because medical doctors are typically wonderful people, but this is not what they do.
No, and there's no training. Like I thought when I did the yoga therapy program, I'm going to university to do my yoga therapy program. I'm going to be trained by people who are professionals in the medical industry. And I'll definitely learn about perimenopause and menopause because at that point I knew for sure that that's what was happening for me. And there was one paragraph in the pathologies textbook that said you may have troubling symptoms during menopause, such as hot flashes. And it was under the menstruation time. That was it. That's all
Yeah.
it said. I
Yeah.
was like, this is just not good enough. And so the medical training is very similar to that. It's really trying to keep people alive and trying to keep people moving. And it's all good. Like if you're having a medical crisis, definitely go to see your doctor and have,
Yes.
go to the hospital if you're having chest pain.
Yes. Yes.
But how would they? So they've been sitting in their car crying, and they don't know what to do. And then what would their best bet be to find a naturopathic doctor that's kind of in their area that might be able to help them in this, realm of, I've gotten no help from the medical establishment.
Yeah. I mean, so one of the things that you can do is speak to a friend, because I find that um some women talk about this stuff, but
Mhm,
others don't. And I've got, tons and tons of women in perimenopause. And the the way that they find me typically is they're they speak to their friends about it. Because
mhm,
I bet you if you've got a group of women who are the same age, one of them probably sees a naturopathic doctor and can tell you if that's like a good referral.
mhm,
Start there. And then, most of us, we give out, like free consultations and stuff like that. So you can definitely book one of those and then book a few, right? Like, so you get to actually speak to somebody before you invest any of your time. And you can kind of get a sense of, like, is this maybe a good fit? And you can typically look at people's websites too, or their social media, and you'll be able to tell if they have a focus on something like perimenopause and women's health. You should be able to gather that just from like a quick Google search.
mhm. Yeah, I tell people that, if no one is helping you, ask Google what's near me, and then
Yeah,
look at the ratings, right? Because if they've been around for a little while, they'll have a rating, and then you can read some of the reviews and see if this is maybe something that might work for you. And I found you through a friend. I found you through Naomi because I was saying I'm planning this CPS symposium,
yeah,
CPMS, and I really would like to have, well, the girls actually asked for a naturopathic doctor
yeah,
because they want to talk to a naturopathic doctor who's really good with like the whole picture, right? Not just, you know, um, it's difficult. Like people are, practitioners are the same where they get their thing, right? I have a physiotherapist that I love and she likes deep needling. Do I like it? No, but it's effective. So I do it. And that's kind of her go-to, right? If she can needle it, she's going to needle it. And there's nothing wrong with doing that. It's just you have to make sure that you're going to be comfortable with their, you know, if it's kind of that we're going to go down a different route, and then if nothing else works, then we'll go to HRT. Or if what you want is HRT, you
yeah.
need to make sure that you're clear about that from the get-go.
Totally. I always have that conversation with people right away. I usually ask them, like, are you looking for HRT? And then this is what we do to get there. And if you don't want it, then we will go this herbal route as well. It's whatever the person is seeking. Sometimes people come with that specific notion in mind of, I'm looking for the bioidenticals. And then I'm happy to go down that route with them, and we ensure safety, and I do the testing, like I said. But it's all options. I
Hmm.
just explain the options, and then the woman chooses whatever speaks to her. It's just my job. Yeah, I just describe the pros and cons, basically.
Yeah. And that's so important because I think just in general, we get that feeling of being dismissed and having nowhere to turn to. And then that's what my vision is for the symposium is bringing together a group of experts who have their own areas. So we've got pelvic floor physio confirmed. We've got you confirmed. And I'm working on a medical doctor I haven't gotten confirmation for her yet, But she's the bomb. Like she's the sweetest little sweet pea ever, and really enjoyed having a conversation with me. But she's expensive, and she knows her stuff, and she's even on the Menopause Foundation board. So she's been doing it for a really long time, and she has a Google rating of 4.8, you know, which, and she runs 3 clinics. So she's the one that I'm really trying to get confirmed. But then we'll have a really nice, because what I wanted to do is give Canadian women Canadian information from Canadian sources that have a variety of backgrounds and let's call them sympathies, right? As far as what kind of treatment they want to do, right? I'm going to present as well on the area of being, from the holistic standpoint, but because it's my group, I can go in there and do surveys and say, like, what topic do you want to hear about? And then I can design my stuff based on what they want to know. And with that variety of people, like pretty much all of your questions should be answered in that 4 days.
I think so. Yeah,
Yeah.
that sounds awesome. Sounds really great.
Yeah, because I that one I last year I felt like we missed a little bit more on the medical side of things. We had a nurse practitioner, but it was very kind of, off the cuff. So you're going to present a little half hour something or other with a slideshow of just like the basic stuff of what a naturopath, we really need to know, like, what is the difference between what you will do compared to what the doctor will do and why you make certain decisions, or you know what I mean, for the woman's care. Kind of like if you could keep in mind that lady that's been sitting in the car crying because
Yeah,
she's
I
the one.
know. I know her.
Yeah. I kind of was her, except for the fact that my doctors are both female. I had a functional medicine doctor because of the pericarditis. So I wasn't thinking about it, but she was looking for perimenopause.
Mhm.
So when I started presenting with some symptoms, she was on it. And I
Mhm.
trusted her completely because she had helped me to get off of the anti-inflammatories.
Good.
Yeah, and so far so good. As long as I don't catch a virus, it seems. And it's such a pisser because, I've done all this work my life, in my adult life, to better myself and to become as healthy as I can. And a dumb little virus somehow sparks pericarditis in my bod, and then I'm going to be stuck on the anti-inflammatories again for however long it takes me to get off of them until I get exposed to another virus. So, the idea that a little virus could take me out is pretty frustrating when you but, everybody, there's so many gifts in the challenges that I've learned, right? Like I wouldn't be working online exclusively if it weren't for that. And if I wasn't working online exclusively, I wouldn't have met you, because I wouldn't have met Naomi, because I wouldn't have been putting on an anxiety and moods class online.
Mhm.
So there are lots of benefits when you embrace the difficulties without letting it like get you down. What are the positive sides of this? And I think if you could put something in there, um, one of the things that I was talking to that medical doctor about was hope, right? We have this just like, now I'm old and everything's breaking down and I can't do the things I used to do. And if you can somehow incorporate that. I don't know if you can talk about maybe some case studies of people that have had that point
Yep.
of coming to the other side
Yeah.
of things where
Mm.
they've got a good treatment plan and they're just in the maintenance side of things with you, because that
Abs-
does happen.
Oh my gosh, all the time. All the time. All the
We
time.
need to know that, right? Like I was talking to a client this last week and I was like, and when the transition is done and this hopeful place, and her eyes kind of glazed over, like she's so far away from that. Is that even real?
Yeah,
Yes.
no, I'm totally happy to speak to that. I always have to, I always have to be careful because as doctors, this goes for medical doctors too, but when you're speaking and when you're, posting and sharing, and you have to be very careful because we get in trouble if we promise results.
Yeah.
So we have these higher standards that, like, say a cosmetics clinic, for example, like they're allowed to promise you like your wrinkles will be gone, and
Younger.
they're allowed to show before and afters. We're not even allowed to do that. We have to be very careful because the last thing you want to do is promise, or really, really ramp someone up that it's going to work and something's going to change for them. And occasionally it doesn't, right? Like we can't promise that this is going to work for everybody. But what I can say is, 95% of people do really well. So we could say things like that, right? I could say
Yeah.
like most people respond really, really well
Yeah.
to what we do for perimenopause. No promises,
No
but
promises.
there's definitely hope to be had.
Do you have the like I designed a comprehensive symptoms list for, people to use as like a guide and also to see if what they're doing is working or helping and to take to their doctors. And I use that as kind of like your intake so that you can
Mhm,
compare after you've been doing coaching with me for a while.
mhm,
Sometimes
mhm.
you're like, I'm not really any better. And then they go and they do the checklist and they
All
look
the
back and they go, oh, wait a second, I am sleeping better. And I have been happier. And actually, well, I haven't had a fight with my husband recently that didn't actually sounds
time.
terrible, but
Yeah,
it
yeah,
wasn't actually about reality, like one of
yeah,
those fights where you're just like, what was I even upset about? I can't even remember. I was
yeah.
just so upset at the moment.
Yeah,
And then they have something that's like more concrete of like
absolutely.
their before picture and their
Mhm,
after picture.
mhm. Yep, well, that's their chart. With
Yeah.
me, that's their chart. And they have their intake package and even baseline testing. Like
Yeah.
testing doesn't lie before and after too.
Because you can see, okay, whatever the testosterone or whatever it is you're looking at, and the vitamin D one, that one really got me because, one of the first recommendations for the fatigue that I was having was to just, try taking some more vitamin D because in Canada, we're probably not getting as much sunlight. I'm very fair. I always wear sunscreen or I burn. Those are my two options. So, more in the winter and less in the summer because I'm out more in the summer. And it was very dramatic for me, the difference that adding in a little bit more vitamin D and making sure that I took it every day. Like I got the little week packet with the, Monday, Tuesday, Wednesday. So if I miss a day, I notice and then I it keeps me on track. And that one's a pretty simple. So some of it is more involved and some of it is pretty simple, but simple doesn't mean it's easy, but it's worth the effort, right?
Mm-hmm. I totally agree.
Yeah. Awesome. Okay, so I think we should end the call there. That was really good. I don't think we got any questions, but people might pose questions later. And then if we do get questions, usually before the event, I'll do like a poll. What kind of topics or what would you like to be discussed? And then I'll make sure that you see that or I'll send it to you so that you can see like, what areas of concern. But those are the main ones. We feel isolated, we feel crazy, we feel alone, and we feel like it's hopeless.
Yeah, got
Not
it. Yeah,
funny. It's
yeah.
not funny at all, but soothing balm. Okay, it's lovely to meet you, Tanya, and I hope that the
Lovely to
weather
meet
is
you too.
good and you get to go outside and are there lakes around where you are?
Yeah, totally.
Go on the lake for me.
Okay.
Love it. I miss the lakes. All right, and we'll be in touch and we'll talk soon.
Sounds wonderful.
Thanks, Tanya.
Bye.